Hi, I'm Yael Maxwell at TCT 2014 in Washington, D.C. Here at TCTMD, we talk with many of the world's leading interventional cardiologists. But what about those of tomorrow? I've rounded up a group of fellows poised to rise to the top of their field to speak about their experience at the meeting, personal and professional challenges, and much, much more. This is Fellows Forum. Why did you decide to attend TCT 2014?
Well, it's a great opportunity for us to see all the new technologies, all the new techniques that are being used, and especially as a fellow to try to get as much learning as we can.
We get to meet not only the best in interventional cardiology across the nation, but we also get to see what people around the world are doing, and I think there is active participation from different countries across the world. So you get to see a good blend of national as well as international people and learn from the experts.
Being affiliated with Columbia University Medical Center, we are part of the faculty factoid staff. So we are here for the duration of the meeting, providing a lot of the factoid information pieces during the live cases for our home institution, and also as part of our ongoing training as part of Interventional Cardiology Fellowship.
Describe your typical day here.
Wake up early in the morning, try to make it before 8 so I can watch the live sessions. I watch live sessions in the morning, and usually, depending on my interest in the afternoon, I go to didactic sessions.
You start around 8 o'clock in the morning. After a few sessions, I will grab a breakfast with one of the key faculty in different institution, kind of share experience with other fellows who's in training, and see how they get things done.
Here I wake up and I go to the live cases. I'm there in the coronary theater for 4 hours. I'm helping out with the slides that are put up while the live cases are going. So I get to watch all the live cases, and while they're going, I have this database of data to go through, and so I'm learning a lot about looking at the trials and how they relate to the procedures as they're happening.
Usually we start with the breakfast symposium, and then usually I try to select cases which are and lectures which are more in line with my education as a first-year fellow.
So being at TCT often feels like the World Series of interventional cardiology. How do you distill all this often groundbreaking information and take it back home with you to your daily practice?
I think that's always a challenge at these big meetings. I think at every meeting we see groundbreaking trials, new data being presented. We see ongoing education being provided for core facility information, and it's challenging.
It's very hard. I mean, to be honest with you, it's very hard to get all the information. But what I'm trying to get here is key changes in the practice. So if it is related to valves, related to catheter, or related to a stent, will be an easier way to stay focused on one or two topics, and each year hopefully will grasp more.
It's always nice to come and say, I saw someone do this on one of the live cases, and they're willing to go ahead and try that.
When you go back to your institution, you discuss with the attendings, I saw this case been done this way, so you can get a lot of the information you did not know and try to implement into your daily cases.
So do you think that attending large conferences such as TCT should be a part of the curriculum of training interventional cardiologists? And if so, why?
Well, it's for sure it has to be. And it is one of the only nationwide conferences that offers free registration for fellows. And this is a big plus.
When you're just in your own institution, you think everything is done one way, and actually it's not. You see different minds, different techniques, different places, different countries does it in multiple ways, which is very beneficial.
The personal collaboration and community building is probably the most important.
It's a great networking event, and it's great to come out and meet all the leaders of interventional cardiology, and it's great for all of us to get together, and we are kind of like a family.
And also, if conferences could highlight that these 2-3 days are the ones that we are going to cover everything that an interventional fellow needs to know, that would be really, really great. And once that comes into picture, I guess more fellows will be inclined to attend most of the conferences frequently.
What inspired you to specialize in interventional cardiology?
Well, I come from a line of intervention cardiologists.
So the field is ever expanding, and there's always something new to learn. So this is what kind of attracts me more, that you always find that there is so much that is more to do and more to learn.
Ultimately, I think everyone's goal is to add value and meaning. And watching my own father have an ST segment elevation MI and being in the back of an ambulance with him was always a strong motivation to do so.
I love the patient population, the physiology, the disease processes. To me, is unmatched in medicine.
Who are your mentors and what have you learned from interacting with them?
My mentor is Dr. John Douglas at Emory. He's one of the pioneers. What inspired me the most is how calm he is, and he's a leader in intervention cardiology, and his composure and the way he teaches you his patient care, his technique is what I aspire to.
The program director is Dr. Ganesh Ravindran. He's the one who introduced me to this meeting.
Over the last few years, I've worked alongside Dr. Eric Topol, one of the absolute stalwarts of cardiology and interventional cardiology. And he has really taught me how to recognize trends in disparate technologies and to see how they will evolve and grow over the future and ideally intersect, and to try and spot those trends.
I have Dr. Samir Kapadia, who is my program director, and he's been very kind enough to guide me further into becoming an interventional cardiologist.
What is your career plan after you finish your fellowship?
Find a job.
I'm keeping somewhat of an open mind. The specialty choice will evolve over my exposure and training in the interventional cardiology period, and I certainly would like to pursue my career in a large academic institution to really build on the translational aspects of interventional cardiology and to see the field evolve and grow and really add to the literature.
My career in 5 years is big academic institution with hopefully groundbreaking trials.
I would someday like to be a program director.
I want to take care of my patients, and I want to teach. Those are the two things that I really am interested in.